Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Srinidhi Kumar Acharya. Don't forget to subscribe my channel, and also please don't forget to give the valuable comments. And as all of you know that in the previous few classes, we were discussing about ADHD, and we have already completed 2 to 3 parts of ADHD. And the last class we have completed up to differential diagnosis, and what are the differential diagnosis that has to be considered when you are looking into a case of ADHD. And you shouldn't be hurry in making any diagnosis, because there are so many similar looking condition, mimicking conditions are there to ADHD. So while doing the diagnosis, we have to be very careful. Now if you see some of the basics of ADHD, now cause wise, this is a very frequently asked question by the parents. Sir, what is the cause for this? Okay, so actually talking, the exact cause of ADHD is still not known. It is told that the decreased dopamine and noradrenaline neurotransmitters in the brain are the main causes. So far it is estimated that probably this particular condition of ADHD is because of decreased dopamine and noradrenaline neurotransmitters in the brain. We know that the brain neuron contains different types of neurotransmitters, and one of the most important neurotransmitter present in the brain is dopamine and also noradrenaline. Dopamine D1 is there, dopamine 2 is there, and it is also responsible for different types of movements, and also dopamine is responsible for modulation of the movement, that is correction, fine motor movements. So now this will decrease the attention arousal and impulse control in the child. It is estimated that this particular decreased dopamine and decreased adrenaline is responsible for decreased attention arousal and also impulse control, impulsive movements controlled by dopamine. So impulse control in the child. So something which is related with the production and use of dopamine is get affected in case of ADHD. Still, the exact cause is not known, and it is an interaction between the genetics, environment, social factors, and neurological factors and antenatal events. This is told as the cause. What is that? Exact cause of the ADHD is not known, but still there is definitely a cause which is because of interaction between the genetical background, makeup, environment, social factors, and as well as neurological factors and antenatal events. Okay, so matraja karanas are there, pitraja karanas are there, satmyaja environmental karanas are there, prasavakalina karanas are there, antenatal, okay, prasava purva karanas are there, and social factors are also there. Now there is a strong genetic tendency. It has been observed that ADHD follows a strong genetic tendency. The arousal related with the dopamine functioning and ADHD patients with the low dopamine functioning. Genetically, we can see that a strong tendency is there to arousal related with the dopamine functioning and also ADHD present with the low dopamine functioning. That means in those kids with the low dopamine functioning, chance of the incidence of ADHD has been observed more. So number of the genes are involved, because with the dopamine functioning and all, so many numbers of genes are involved which may directly affect the dopamine functioning. Okay, this is one important cause, genetic cause. Second important cause is environment. Alcohol spectrum disorders or exposure to the lead and polychlorinated biphenyls and exposure to organophosphorus poisoning. So this has been also considered as one of the major cause of ADHD. Okay, so therefore environmental hazards also play a very important role in case of ADHD. Now, functional impairment in the brain neurotransmitter system is there. One thing is very clear. Whatever may be the cause, there is some functional disturbance in the neurotransmitter functioning is there in the brain. And that is a cause, dopamine, adrenaline, noradrenaline, etc. This involves the dopamine and noradrenaline. The pathways of both dopamine and noradrenaline originate from the ventral tegmental area and the locus coeruleus, and then project into the prefrontal cortex of the frontal lobe. The frontal lobe is related with the executive functions, okay, attention, executive functions, attention, etc. So cognitive control of the behavior, then motivation and reward perception and motor function. So these are the important functions of the frontal lobe. Frontal lobe is related with the attention, Frontal lobe is related with the abstract thinking. Frontal lobe is related with the cognitive control of the behavior, motivation, reward receptions, and motor functions, etc. These are all the functions of a frontal cortex. The frontal lobe is basically a motor cortex. Now, these pathways are found to play a role in pathology of the ADHD. The children with ADHD, there is a genetic reduction in the brain volume also. It is also seen. A child with ADHD, there is also a general reduction, general reduction in the brain volume also, with a greater decrease in the volume of the prefrontal cortex. That means volume of the prefrontal cortex is reduced. As a result, so many centers are getting affected. Okay, so that has been also observed in case of ADHD. Now, there are so many comorbidities related to ADHD. One of the important comorbidity related to ADHD is autism spectrum disorders. Okay, so autism spectrum disorders may be an outcome of the ADHD. Comorbidities, we are talking complications, other words to say, they are the complications. Autism spectrum disorders, learning disabilities, intellectual problems, Tourette syndrome, conduct disorders, antisocial personality disorders, intermittent explosive disorders, anxiety and mood disorders, bipolar disorders, persistent bedwetting. These are all the comorbidities related with the ADHD. A child with ADHD may also have all these problems. Then adolescents with the ADHD are more commonly have the problems like substance abuse problems like alcohol, cannabis, or tobacco, etc. Then reactive attachment disorders. We have reactive attachment disorder, severe problem to relatively attach with the society. Okay, so they cannot attach themselves with the society. See, reactive attachment disorders are there, and a sluggish cognitive temperament is also there. Then certain non-psychiatric conditions with the ADHD they are absolutely non-psychiatric condition, but still ADHD may be there, like epilepsy, okay, like asthma, like celiac disorder, like migraine, like hyperthyroidism. So these problems, these are all the comorbidities related to the ADHD. We should know this. Otherwise, in the diagnosis, we may some error. Now, how to diagnose ADHD? No single test is available at present for the diagnosis of the ADHD. Comprehensive clinical diagnosis is based on inattention, hyperactivity, and impulsivity, and behavior is sufficient. The behavior which is affected severely and persistent to cause the functional impairment. Okay, so this is one of the important thing for the diagnosis. That means no single test is available, and we have to look into attention part, hyperactivity part, impulsivity part, behavioral part, neurological part, and then we have to see the functional impairment, and then we have to come to a diagnosis. Screening should be done. Okay, now for the diagnosis purpose, you can go for screening. Okay, ask few questions about how the child is doing at home and in the school. They're two different environments, and there is a scale which is called as a Vanderbilt scale. So this scale is usually used to assess the used for the diagnosis assessment. Clinical judgment is required to analyze these scales. Of course, as I told earlier, the functional impairment which is happening, then clinical impairment which is happening should be also required along with these scales. One of the scale which is commonly used is the Vanderbilt scale. Now, based on this DSM, Diagnostic and Statistical Manual, DSM-5 criteria for the diagnosis of ADHD. Again, the no single test is available. This is the first one. Comprehensive clinical diagnosis is based on inattention, hyperactivity, and impulsivity, and behavior is sufficiently severe and persistent to cause a functional impairment. This is one criteria if this is happening. Second one is screening. Third one is ask few questions about how the child is doing in the home and in the school. This part we have already seen. And Vanderbilt scale. Okay, now what is DSM-5 criteria says? 6 or more symptoms, there may be the symptoms of inattention for the children up to the age of 16 or 5 or more symptoms for adolescents, and 7 or and above the 17 years and other older children in adults. Also in adults, symptoms of the inattention have been present for at least 6 months and they are inappropriate for developmental level. This is how ADHD we have got, how we have to diagnose inattention problem. If the symptoms of inattention have been present for at least 6 months and they are inappropriate for developmental level, this is one criteria. The classical symptoms of inattention syndromes should be also seen. What are they? Often fails to give the close attention to the details, or makes careless mistakes in the school work, at work, or any other work, or with any other activities. This is how to identify the inattention. So we are frequently telling inattention, but how to identify it? Yes, often he fails to give close attention to the details, or he makes the careless mistakes in the school work, or in any other work, or any other activities. Often has trouble in holding the attention on task or play activities. Often does not seem to listen when spoken directly. These are all the symptoms of inattention. Often does not follow through on instructions and fails to finish the school work in time, and other duties also in the workplace. Example, loss of focus, sidetracked, etc. Often has trouble in organizing the task and activities. Often avoids the dislikes, or he is reluctant to do the tasks that require mental effort over a long period of time, so such as schoolwork or the homework, etc. Often loses the things because he is inattentive, and necessary tasks, and also the activities, school materials, pencils, books. Okay, so always they are missing. The tools, wallet, skis, paperwork, eyeglasses, mobile telephone, etc. So because he is not concerned about that, it's not inattentive. Because of inattention, he loses the things, personal belongings. So often easily distracted and often forgetful in daily activities. So this helps to identify whether the child is having inattention or not. How to identify the hyperactivity and impulsivity? 6 or more symptoms of a hyperactivity, as mentioned below. Like impulsivity for the children is up to 16 years, or 5 or more for adolescents of 17 years, and older and adults. The symptoms of hyperactivity, impulsivity have been present for at least 6 months to an extent that is disruptive and disappropriate for the person's developmental level. This is the criteria. Now, hyperactivity and impulsivity, how to identify? Classical symptoms of hyperactivity and impulsivity, like often fidgets with the or tap the hands with the feet, or squirms on the seat. Often leaves the seat in situation when remaining seated is expected. Teacher saying be remain seated, but he leaves the chair. Often runs about or climbs in situation where it is not appropriate. Often unable to play or take part in the leisure activities quietly. Then they are often on to go. That means always on movement. Often driven by, just like driven by a motor pump, like that. Often talks excessively. Often blurts out an answer before the question is completed. They come out with the answer which is inappropriate before the completion of the question itself. Often has trouble in waiting his or her turn, and often interrupts or intrudes on others. So these are the symptoms that we can identify that child is having hyperactivity or impulsivity. Now, what are the red flag signs? The red flag signs are declining in the academic activities frequently or persistently, and relationship with difficulties with the peer and family members. He has got a lot of relationship problem, not able to maintain the relationship, friendship, and social interaction, etc. with the family members also. Previously, it was there with the society members. Now with the family members also is having the problem, and symptoms of emotional problems. These are considered to be red flag signs. Now we will have the case discussion on this condition so that the things will be clear to us. See, Manju is making her parents crazy, and she is irritable all the time and never does anything that her father asked to do her. And when she does not get her own way, she throws the full-blown temper tantrum, and her behavior is also a big problem in the school, and her teachers cannot get her into the day-to-day work. So she simply refuses. So she is also defiant, sorry. Okay, oppositional defiant. Won't say or stay in her seat and talks continuously, and she is disturbing the entire class. Okay, this is a case scenario. Manju is making her parents very crazy, so they are very much under tension, and she is very irritable all the time, and never does anything that her father want to do her. So she does not get her own way. She throws the full-blown temper tantrum. She throws everything. Now, if you look into this case actually, so this looks like a combination of ADHD and opposition deficient disorder. Defiant ODD. Opposition deficient disorder. Because she is also giving some reactions. She is also defiant and won't stay in her seat and talks continuously. She refused everything. Whatever told by the parents, she refused everything. Okay, so of course this may be predominantly a case of ADHD, but we can also see the intermingling of a mixing of the symptoms of opposition deficient disorder. Therefore, screening is very important. Now you go for the screening, like screening for the attention, screening for the hyperactivity, screening for the impulsivity, as explained in the DSM-5 criteria. Then you can get a clear-cut idea. Otherwise, you will be get confused. So this is about the causes and other aspects and diagnosis of ADHD. So thank you very much for listening to me, and please don't forget to subscribe my channel and also give the valuable comments. We will again meet in the next class. In that class, we will discuss about the treatment, which is very important, treatment part of the ADHD. Thank you very much, and we will meet